It will be a struggle to contain the spread quickly. I think it will take many, many months for us to be able to get this outbreak under control. I do wish that the WHO and others in the international community had been more forceful sooner in raising the alarm, but it is better late than never. And so hopefully this will give us some additional momentum in trying to increase our response.
There is some debate about the timing, about whether it could have been useful earlier, but I think at this point, what really matters is going forward, what can this declaration do and how can it really gather international support and strengthen and accelerate the response to the unfolding epidemic around the world. I think WHO's statements were really strong on that when they announced that, and the urgency of doing all that we can to try and contain this and prevent it from becoming an endemic in various places around the world. So it's important to stay with that goal and to enlist whatever help we can from donors and from countries who are ordering doses of vaccines and therapies and working most closely with the developers of these products, and on the issues of surveillance and making sure that we are doing everything we can to try and organize surveillance, really argue for countries stepping up their surveillance for monkeypox all the way down to the state and local level, provincial level.
I think it's an acknowledgement of the seriousness of the monkeypox outbreak across many different countries and continents. And I think it helps to raise awareness and mobilize response, which I think is really necessary. It's clear that we're behind the curve in responding to the outbreak, and we need to up our response if we're to try and get our arms around it.
Definitely will be a major global challenge to contain monkeypox, given what we now can see. Now, there are more than 16,000 cases have been diagnosed. We see it in many countries around the world. I think what is still a reason for some hope and a plan to try to contain this disease is that, as for the most part, been spreading within a particular demographic of people who are men who have sex with men. That's the great preponderance of cases. And because of that, efforts to try to care for that group of people and provide them education and resources and vaccine wherever possible and therapy wherever possible, the efforts to try to bring this under control can really focus on that particular demographic of people. I think the concern is that if this then continues to spread into other networks of people or other demographics, it gets increasingly difficult to contain this disease. So while we now know where it's being spread and have the chance to intervene, I think this is the time when all available resources should be going towards that goal.